From the Vox Populi Studios in Miami Lakes, we bring you the Miami Lakes Business Podcast, brought to you by the Miami Lakes Chamber of Commerce. Today we bring somebody different than what we have invited before. We have today with us Mario Espino, who is the founder and chairman of Complete Care Management Services, CCMS. The reason why we brought him in, not only because he's a member of the chamber, obviously, but he has a unique approach to medicine, something that maybe a lot of people have never seen. But I remember seeing that when I was a young boy back in the island of Cuba, how the doctors used to do things. So, Mario, welcome to our podcast.
Thank you so much, and congratulations on your 30th episode.
Thank you. How did you come about this type of service?
Well, I knew that I wanted to help, and I think that the only place that I could really do it was if I was taking care of the very sick, and that was something that I've been involved with for some time now, being in the CMMI space, which is the Centers for Medicare and Medicaid Innovations, which is where all the innovative things come out of. Seeing that there was a very small percentage of the population that was actually represented a large percentage of the total cost, so it told me one thing, and is that maybe these individuals were being poorly managed. And as my education in the field, I've been in the field for 40 years now, but we're primarily in this value-based space of these next generation accountable care organizations. I learned more and more about the easy things that could be done that could reduce costs. We talked a little while ago offline, but we talked about some providers, and we could collect data, and the government can give us data back and tell us, well, this provider is a high cost provider and low quality, or this one's a high quality low cost provider, or this one's a low cost high quality provider, which would be the ideal scenario, and how we can switch these patients over to these high end result type physicians or specialists was one of the keys. I think that one of the things that I found early on was that you needed to be in the home. If you were going to make a difference, you started talking about that, and that was so cool to hear you talk about how it was in the early days, where the doctors were coming on, they had the little black bag, and and they were going into the patient's home. And that's what we've done. We've taken that right back to the home. So now we see patients in the home that are very sick, or that have multiple chronic conditions that can, and in a moment's notice or within a couple of days, decompensate and push that individual into a hospital, where we could have managed that better and not end up in a hospital.
So what you're telling me is that you're actually bringing back the old way of doing medicine or exercising medicine, which is going to the patients, to their homes, and then telling them and doing tests and doing all the things. Tell me all the capabilities that you guys have that you can do.
That's a great question. I think that, and we talked about this also a little bit, is that in the home you feel and you see and you have better management of what's going on around the patient. And it could be as simple as there being no one at home that can manage the medications, so the patient manages the medications as best they can, because their significant other is in a worse position, or maybe they're both bad. And we see this repeatedly over and over and over again. So the idea was never to start a business and say, hey, listen, you have so many patients now, let's get them in a van, let's take them over to your office, inconvenience them. No. Maybe that's okay with another type of patient, but not the ones that we're talking about. Not the 3, 4, 5% that represent 50, 60% of the total cost. These patients are really sick, and it's a shame not to manage their disease correctly. And you need to do it in the home. You cannot do it in the office. You only see one small picture, what you maybe the medication reconciliation is done as simple as, hey, any changes in your medication? No, boom, you're off. So that's it. So now we're on to medicine of the moment, as I call it, medicine of the moment. And that is, let me see what's going on with you and how can I treat this now, but very little consideration of how we do this long term. Maybe the medication is a way to control the disease long term, but what about the idiosyncrasies at home that are driving maybe that particular disease to manifest or get bad to the point where we need to get that patient to the hospital. So yes, we are going back home. Yes,
we all know that in this market that we live in, there are a high number of clinics, and they all offer. They try to offer more than the other one next door or whatever. But I think what you're saying makes a lot of sense, because all those bosses that they use to pick the people up, all the employees that they have there, whatever equipment they have, all that costs money, and that's money that I'm sure that is taken out of the pot that every patient contributes to based on the amount of money that they get from Medicare or Medicaid or whatever. So you're actually saving from, if I guess right, you're actually saving the government money.
You know what? It's a perfect segue, and it's a perfect match to what we're doing. And absolutely, we are definitely saving money to the government. We've done a couple studies out now that we've got the consolidated data, and it shows that we have a 400% reduction in patients that should have been in the hospital that don't go into the hospital. 400% reduction there, and we have probably a 800 or 900% reduction in hospital readmissions, just because of the things that we're doing, just because we're going into the home and we're sort of trying to make an intelligent decision based on additional facts that the doctor does not have when they're seeing that patient in their office. And you said something else a little while ago, which is a challenge. South Florida has a lot of people that do a lot of things, and a lot of things are good things, and there's a lot of things that are done that are bad. It's the capital for some of the most egregious things that happen in healthcare. And I've tried to always stay away from them, and the purpose of our business is to try to educate whatever agency we can in what we're doing, so they can readily see if there's something going on that shouldn't be going on. That should never happen. That should never take place, because what we're doing is we're taking money away from the pool, and that lessens the capabilities of other patients to be able to receive.
It reduces the amount of benefits that are available out
Absolutely.
there.
Great question.
It brings to mind not only the savings on the economy from Medicare or Medicaid that you're actually causing an effect to it, but also the psychological. I think patients they would rather be home in their familiar surroundings, and then have somebody come in and do whatever needs to be done, and then when they finish, that's the end of it, and they go home and they stay home, and they don't have to, especially with the way traffic is and the hassle that you have to go through, to get to where you want to get. I remember when I was a young boy, and I suffer real bad asthma. And I remember, if I had an asthma attack in the middle of the night, and my dad would call the doctor. I remember that doctor in our town, he didn't have a car. So my dad had to go pick him up. But it didn't matter the time. 2 o'clock in the morning, 3 o'clock in the morning, Dr. Chavez would come to my house. And I remember distinctively that just by seeing Dr. Chavez come into my room, I felt better.
Yeah,
it's amazing. Yeah. It was incredible, but I remember that distinctively. So I think that effect actually happens on a lot of people that experience your approach to medicine.
Yeah, it's a unique thing to be sick and there be 100-degree temperature outside, or it be raining outside, or you know that when you get picked up by this bus, and you alluded to a little while ago, and you're going to be on the bus for two hours, wait for the doctor for 2 hours, wait for 2 hours to get back home. And some people just can't do it, So it was important for us to make sure that we had a platform that we could do everything that we needed to do in the home for those patients. And again, kudos and God bless the acute care facilities. And there's a space for them, Just these patients that get exacerbated because of their lack of management of their chronic diseases, that can't be done effectively in the home, and we're living proof that with numbers and studies, is a big thing, because in the hospital, if you have an exacerbation, there's medications that control the exacerbation. That means that you just took a high blood pressure and you brought it down, and once you stabilize it for a day with these more aggressive medications like IV and so forth, and injectables and so forth, Now you stabilize the patient. Now the patient goes home again. But what was the reason why that patient had that hypertensive crisis? There's never any time for that. Sometimes they do it, but nowadays the government wants, not the government really, the insurance companies want to get the patient in and out quickly. Again, medicine of the moment, and it doesn't work. It doesn't work. We've seen it now with the results from handling some hospitals, or one particular hospital where we've been doing a study, and that hospital was close to 20%. It means that out of every 100, 20 people would return to the hospital within 30 days because they were confused, And we've taken that now, and it's a 2% or a 3%. So it's a constant 2-3%, not over a 30-day period, which is the period of time that the study is in, but in a 60-day and 90-day, we're still able to hold those percentages down. So it's an incredible thing what communication and being really in the home and that environment will do to enrich us and enrich the type of data that we collect from the patient to tell us that, hey, we need to do this, and this, and the results have been incredible. We save lives every week, really.
I'm sure you do.
Fred, it's incredible.
We were talking before we started the podcast. Let's tell the people, what does the doctor or the PA nurse, what do they do when they go to the people's home, let's say for the first time? I know you have follow-up after that, but for the first time, what do they do?
Yeah, so great question. Another great question. We're talking more about the vertical business model of a physician, right? So the physician, the provider, whichever they may be, MD, PA, or FMP, or nurse practitioner, they go into the home, or they see the patient gets triaged, they do a medication reconciliation. What are the problems that you're exhibiting today? What are your chief complaints? That's treated, and then the patients are given a new prescription for medication or renewal, and then the patient leaves. Completely different than what we do. We're in the home because we have a certain number of documents that we want to review with the patient, mostly around the preventive medicine side. So in the first 30 days, we do a medication reconciliation with the patient's medications, pictures of the medication bottles that tells us afterwards that, hey, this was Dr. Fred, there was a Dr. Mario that ordered this, and and this medication was last filled in January of 24. Or it was January of 23. So then, they haven't been taking the medication. Maybe it's a co-payment issue. There's a plethora of things that can happen, in the home from that vertical aspect. But to answer your question specifically, the doctor sort of loses touch when they see that patient. Once a patient leaves that office, they've lost contact with us. But with us, our nurses are in there every week. And if you feel bad, you call us and we get there. I just showed you a little while ago, our phone, where you saw that how many people we had in the field. So if we had someone call us today, right now, and say, hey, listen, Mario, I don't feel good today, for whatever reason it is, within 15 to 20 minutes, we can have someone there to do a battery of tests. When we are there and we see things that are going wrong, we have the instructions are to stay with the patient. And then it's elevated to a doctor. A doctor reviews the information, and either we call 911 or not. And when 911 has shown up, because things are really bad, they thank us because of the amount of information that we stayed there, one, and two, the amount of information that we're able to give them as far as historical data of that patient and all the vitals and EKGs and, even, hydration testing, which is a main factor besides medication on decompensation. But I don't want to get too far away from your exact question, and is that the process that we have enriches the doctor's ability to be able to make the right decisions on the patient because they have fluid weekly information on that patient.
So the patient will call you, and we'll go later in the program before we end to let them know exactly how to reach you.
Okay.
But once they call you, and then you dispatch this nurse or this doctor or whatever, and that doctor or nurse will be kind of married to them for the duration,
God willing.
right? And on a weekly basis, they'll be able to even to monitor even the how they're taking their prescription. Because I know that especially the Hispanic people, they have a tendency of prescribe themselves and manage themselves, and sometimes they don't do a very good job.
Google doctors.
Yeah, right. So do they do that as well?
They do. I would like to tell you that this is a special group and they don't do that, but no, we do have that, and we try to control that, and we all by doing the medication reconciliation the way we do it, then we have a better grasp of if they're self-medicating or they're not medicating, or if there's issues with getting that particular medication because of a copay. We do a bunch of other things as well. We didn't speak about Fred, but the idea of having a patient at home and them having a limited income is a very serious thing. And it could produce some downstream effects. Maybe not buying a particular medication because they don't have that capability, but in this particular company, we take a holistic approach at medicine and behavioral health and the psychosocial environment of the patient. So we've taken an inordinate amount of time to put together all the social programs that are out there that can assist the patient, whether it be food related or whether they can go on the QMB or QLMB programs, which subsidize. And I get really mad with this because you see on TV that they say, "Hey, give me your Social Security. Or give me your zip code, and I'll tell you if I can increase your Social Security check." Well, that's a scam. There's actually a program which is called QMB and another one that's called SLMB that fund that, but it's a federal program funded by the state, and you need to apply for it. And we have the capacity of knowing whether those patients are on or not. And then we go through the process of identifying whether or not they qualify. And if they do, then we get them on the program. If they don't have food at home, we get them to get their food, transportation, a host of things. If they have financial issues, we try to write a small draft of, requests for funds from different organizations that provide those type of services that will provide us $20, $30, $40 on a monthly basis for that patient to get a particular medication. So it's not only a very linear approach to the patient. We've opened up the playbook completely, and we are doing everything that we can, including remote patient monitoring, which tells us when they use these apparatus, they all have an AT&T chip. So it looks very similar to a product that would come off the shelf. The only difference is that it has an AT&T chip in it. So once you take your blood pressure, or you take your blood sugar, or you take your oxygen saturation, it comes in to us immediately. And 24/7, 365 days a week, we have people monitoring that will tell us, hey, listen, wait a second, Mario is at 180 and 110. Right away, sparks the on-call person. If we're after hours, it'll reach to a manager or a director, the clinical directors, and they'll call right out and see, or that coordinator, and call us the patient. Hey, how are you doing? Are you feeling okay? Yeah, I'm feeling okay. No, but your blood pressure is a little high. Did you take your medication? Oh, I forgot to take the medication. Maybe something as simple as that. No, well, can you please take it? We'll call you back in 30 minutes just to check on you. Some things like that simple are maybe the reason why we have so little strokes in a population that we manage that has a propensity of high strokes, because we're managing those vital signs, not only from the machines that have the AT&T chip, but also with the collection of data. Every time we go into the patient's home, we collect all those vitals. All those vitals are lifted by our back office and then put into a program, so then we can on a monthly basis take a look at all the interactions. Are we seeing that everything is running horizontally okay, or are we seeing peaks and valleys, that says that either at one point in time, maybe in the morning, they're not taking their medication, or they need more medication in the morning, and then their heart rate goes down in the evening because they're taking too much medication. I mean, there's a plethora of things that we do that are just novel. Nobody else does them. From hemodynamics in the home to hydration testing at home.
Mario, tell me, how many employees do you have right now in the company?
60 employees.
60?
60. If I tell you what the projections are for the next 2 years, because we just finished it, because we're looking for funding, an 7A loan. I can tell you that the projections say that we'll have 1,000 employees in 2 years' time.
Wow.
So
I think what you're doing is wonderful. What you're doing is a great idea. I don't know of any other entity that offers, what you're offering. Yeah. So how do the people get in touch with your company? How do they?
Easy, not that complicated. Oh, you know what I mean? If you got a pen and a piece of paper, if you can write down this number, it's a sort of fix-all for all situations, which is 877-212-2267. 877-212-2267. So it's 877-212-212 CCMS. So whichever way you call the number, they'll always get you live. We'll always get someone live on the phone with you. Just ask to speak to someone live. They have instructions. Our reception has instructions to always get one of our clinical staff involved. And there's certain things, there's certain programs today, even though we've had a tremendous amount of acceptance, Fred, with most of the other MSO, not MSOs, but HMOs. And it's been a project getting there, because early on it would take us, a year or so to get paid. But most of the large organizations, most of the large HMOs, including Medicare, which obviously it's not Medicare free is a no-brainer.
Right.
But most of the other insurance companies have joined the bandwagon. They see even though
we're the value.
Oh my God! It's an incredible resource for them to save dollars and apply them somewhere else. But it's an incredible resource for us. The way we see it is to keep that patient out of the hospital. We're very close to one particular hospital. I want to mention their name because of a non-disclosure agreement that we have with them. But we see an uptick in the last 3 or 4 weeks of COVID. So that just in itself will give us the ability to be able to, be on top of, the patients when we see them. Say, hey, are you having a fever? Are you having a cough? What is this particular strand of COVID looking like? Is it looking more like, stomach ache and sore throat? What is it that we're looking at? So we're actually looking for the novelties in the space that we occupy for us to be able to identify that a particular patient may be experiencing something like this. And it's it's pretty clear to us and to me specifically that that COVID has got long-term implications.
Oh, absolutely. Yeah, absolutely, no doubt about that.
I'm one that almost bit the
dust.
Bit the dust there. It was 12 days in the hospital.
Oh my God.
12 in the hospital, and they came back. They had to do a heart procedure on me. And today, whenever I get COVID, it is an ordeal to keep me out of the hospital. My saturation levels drop. It's really important to be on top of that.
Wow.
But to get in touch with us again, Fred, it's 877-212-2267, 877-212-2267. Ask to speak to a clinical director or clinical manager. You can ask to speak to me, which is your best bet. Ask to speak to Mario Espino or my wife, Gladys Espino. She's the chief operating officer for the organization. Ask to speak to one of us too, and we'll get you in the right place.
Well, wonderful. I think what you have brought to the table here is, something really great, and something that I think that a lot of people will, really take advantage of.
I hope so.
At some point in time in their lives. And I want to thank you for accepting our invitation to be here in our podcast. It's been certainly nothing less than very interesting.
Thank you so much.
It was always good talking to you and hearing you, with all the expertise that you bring to the table. So, again, thank you so much. And
I appreciate it. One last comment before
yes,
we sign off.
absolutely.
And I said, the program is good for the patient, or someone that can be benefit from the program, or and you have friends that are that are by themselves or that struggle from time to time. Let us have an opportunity. What we're doing is really great, and I appreciate the city of Miami Lakes and yourself spending time with us and giving us this opportunity to get out and talk to some of these people and tell them that there's other programs out there that can help them, and they can remain at home for a long period of time. So once again, thank you so much. And 877-212-2267, call Mario or Gladys, and we'll see how we can help you.
So there you have it, folks. The services that CCMS will offer you. And so don't hesitate. If you need it, call them up, and they'll set you up and take excellent care of you. So again, until next time.
Thank you. Thank you.